Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about the link between Alzheimer's disease and gum disease. Let's start. So today's episode is going to be very interesting. I was just going through the literature and reading the regular articles where I found out that there is and possibly could be a link between gum health and disease as well as Alzheimer's disease. Now let me talk to you about dementia, which is an umbrella term. That is basically, dementia means loss of cognitive function, loss of brain functions, memories, and basically it relates to the deteriorating quality of life of an individual, usually pertaining to older age and other risk factors such as inflammatory conditions, lifestyle diseases. So coming to dementia, that is around 47 million people are affected by dementia, and of this 60 to 70% of the people are suffering from Alzheimer's disease. Now Alzheimer's disease is actually characterized by neurofibrillary tangles and senile plaques and the secretion and deposition of amyloid beta protein in the brain, which leads to progressive neuronal degeneration, nerve damage, as well as neuropathic and neurotic changes that leads to decline in cognitive function. Now, why am I talking about this as a dentist? When I was trying to go through Alzheimer's disease for whatever reasons, because I was trying to find out any possible links of gum health and disease as being a periodontist to other diseases, systemic diseases. So I came across the link between Alzheimer's disease and gum disease because of some common pathways. Let me first talk about Alzheimer's disease, where basically there is cognitive decline, progressive cognitive decline, and the initial symptoms, which might be taken for granted, also start around 15 to 25 years before the actual disease with symptoms. So basically it's a person who develops Alzheimer's at the age of 70 with symptoms probably was showing signs 15 to 25 years ago as per the literature. Now for that purpose we have to find out what is the actual pathogenesis of Alzheimer's, and Alzheimer's pathogenesis has three proposed theories. The first one being the amyloid theory, which means there is secretion, over secretion and deposition of the amyloid beta protein such as beta amyloid 40 and 42 in the white matter of the brain because of different things, because of genetics, because of the cleavage of the amyloid precursor protein through different channels, and that's why there is over deposition and forms senile neuritic plaques in the brain. On top of that, you have to understand that there is reduced clearance of amyloid protein, because of which because of the fact that the blood-brain barrier could be vulnerable. It could have other things such as endothelial injury and in blood vessels, because of which you can have the reduced clearance of amyloid. Because of that, there would be increased amount of amyloid protein in the brain, leading to cognitive decline and neuronal degeneration. Now the second theory is the inflammatory pathway. That means most of the risk factors that are seen with Alzheimer's is first of all genetics, old age, smoking, hypertension, cardiovascular disease, insulin resistance, obesity, and all these other things, which are usually lifestyle and chronic lifestyle related disorders. Now on top of that, it has been found that there is definitely a pathway of inflammation that is seen when we had compared in the literature people with Alzheimer's with matched controls. It was found that the inflammatory pathway was very much active in these patients, such as chemical mediators such as interleukin 1, interleukin 6, tumor necrosis factor alpha. Also the amount of microglial activation that's there in the brain. That means there are some microglial cells in the brain which are usually macrophages, which are defense cells, that generally remain dormant when the brain function is normal. Otherwise what happens is once the disease begins, they get activated and then they start eating up the synapses of the nerves and the nerve synapses and cause neuronal degeneration, which leads to neurotic problems, at the same time cognitive decline, and then dementia. Now the inflammatory pathway is the second pathway, and the third pathway is the pathogenic pathway. That means direct pathogens have been isolated from autopsy brains of Alzheimer's disease, such as spirochetes, Treponema dentacola, Porphyromonas gingivalis, Echinella corrodens, Chlamydia pneumoniae. These kind of organisms have actually been found in the brain autopsy of Alzheimer's disease. Now there is no perfect cure, there is no permanent cure of Alzheimer's disease, unfortunately, and it's a progressive neurodegenerative disease that causes a lot of burden on the individual, that is the patient, and the family and the caregivers at hand. Now why am I talking to you about this as a periodontist? Because of the fact that all of these theories that have been proposed, there is an actual link with periodontal disease or gum disease, because of the fact that periodontal disease is also a chronic lifestyle disease, which is an inflammatory disease in origin, originated by mostly bacteria, that means the pathogens. Oral cavity is connected to all of the body through the bloodstream, so definitely there is transport of inflammatory markers, mediators. Because of the fact it's been found that the blood-brain barrier is permeable more in Alzheimer's patients and dementia patients, there could be a direct transport of the microorganisms that are pathogenic for gum disease to go into the brain. At the same time, the inflammatory response that is created because of gum disease, that is periodontitis, could evoke the same response in the brain because of the bloodstream and the chemical mediators. Apart from the amyloid protein, there is also a tau protein, which is basically hyperphosphorylated in Alzheimer's disease. Now that also is related to the inflammatory pathway, and there is a definitely common inflammatory pathway when it comes to gum disease and Alzheimer's disease. There is no cause and effect theory that has been accepted or proposed, but definitely a link, a biological link between these two disease processes. Because of the fact that the inflammatory pathway is common, there are a lot of pathogens that are common, especially Porphyromonas gingivalis. This bacteria that causes gum disease and bone loss has been known to release toxins such as gingipains that have been found to cause neuronal damage, and these gingipains have been found in autopsy brains of Alzheimer's patients. Now, to conclude, what am I trying to say is that if you are a person who is having some sort of neglected oral health, you are at a higher risk of Alzheimer's disease. It's been found in studies that people who have overt periodontal disease have 1.75 times the risk of developing Alzheimer's disease, and retrospectively Alzheimer's disease patients have poorer oral health, lesser number of teeth compared to normal matched controls. And so that's why it's my responsibility as a gum specialist, periodontist, and a dentist and an oral healthcare expert that for whatever reasons, whatever is in your hand, you cannot do much about the genetics, but the epigenetics as well as the environmental factors, you can curb these things if you want to curb the inflammation, overall inflammation in the body, such as these all inflammatory markers, even in C-reactive protein that is found more in Alzheimer's as well as gum disease. You can make these levels be curbed down. You can mitigate them by getting your regular oral prophylaxis and dental treatment done. At the same time, maintaining good oral hygiene, getting regular checkups done, and making sure that your oral health is good, it is harmonious, it is as pristine as whatever is plausible and possible for you. So that's very important. So you need to take care of your overall health through your oral health, as well as your mental health and cognitive health because of your oral health. That's what I'm trying to say. So if you're watching this episode, by the end of this episode, you need to understand that your oral health is absolutely important. You need to brush twice a day. You need to change your toothbrush every 3 months. Make sure you visit your dentist almost every 6 months to 1 year. Get regular checkups, get regular screenings, and get regular cleanings done as much as possible, and whatever your dentist recommends. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp. I might take a few days to answer back, but I will revert back to you. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.